Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about a fascinating subject, changing behaviors, and joining me is Dr. Daniel Duffy, the Dean of the University of Oklahoma School of Community Medicine. Welcome to the program.
Thank you very much, Pam. It's great to be here today.
Now, before we get into our topic, because you've been here before, but I want you to clarify for people who may not have seen you some time ago, the School of Community Medicine, I want to start there. That's an odd name for a college of medicine. So how did the university come up with the School of Community Medicine, and what does it mean, and what change brought that about?
That's a great question. A number of years ago, Dr. Jerry Clancy, who's president of the OU Tulsa campus, was dean of the school, dean of the OU Tulsa Medical School, and he realized that the health of Tulsans and Oklahomans and the healthcare in our community was actually among the lowest in the nation. And so he determined that it would be very important for us to use the resources of a college of medicine to actually improve the health of an entire community. So we searched for a name that would reflect that mission of the medical school and came up with the School of Community Medicine. And community medicine means that we're applying the same principles and practices that we apply in medicine to the individual patient to the entire community. We understand that the health of individuals depends on the health of the community in which they live, and the community's health really is the aggregate of the health of all the individuals in the community. And so in Tulsa, we live in a somewhat divided community, and a community that really has not looked at its coherence and its integration as a factor in its overall health statistics.
So with that kind of focus, which is fascinating, does that mean, because you think of traditional, most of us do, a traditional college of medicine being where, of course, persons are educated to become physicians, and if they do practice or clinicals, it's in a hospital or, you know, or a nursing home or some kind of setting like that. Has that fundamentally changed how those who are educated actually feed back into the community?
Those elements that you mentioned remain pretty much the same. What is different is we realize that every one of those hospitals is in a community. Every one of those nursing homes is part of a community. Every one of those patients that are seen in an office come from a community. So the students at the School of Community Medicine learn how to treat and diagnose diseases within an individual, but every time they are cognizant of the fact that that disease in that individual person is part of a larger picture, the context of the community.
Okay, that is really good, because as a result you can then go into the community, whether it's through the churches or other kind of facilities, to try to help change or to look at behaviors that can then help improve the health of that community.
Exactly. Exactly.
Excellent.
So beyond the doctor's office are all of these other aspects that you mentioned: schools, churches, workplaces, the streets. All of these are now very important aspects of health and can be influenced not directly by the doctors, but indirectly through the various resources that we have available to build a community.
That is excellent. So looking at that, I want to sort of get into, they say, a segue into our topic of changing behaviors. Now, when we think of the global concept of changing behaviors, that's pretty difficult. I mean, when we think about that, we may think, well, little children, you can change their behavior up to a certain age, but once you get to a certain point in life, forget it. You know, it's there, it's not going to happen. So how should we look at this just concept of changing behaviors? You know, do we have to reorder how we think about just changing behaviors in general before we get to some more specifics?
Yeah, I think that's a really good point. Behaviors that we're talking about are habits. And in my context, the behaviors are behaviors or habits that affect our health, such as smoking, overeating, excessive drinking of alcohol, use of drugs that are mind-altering. Those kinds of aspects are the behaviors that we try to change to have healthier outcomes for our overall health. Now, those behaviors were all learned as we grew up, and we probably learned most of those behaviors in a very positive way. They worked for us. There was a good reason for doing it. Let's use the example of overeating high-fat foods.
Right.
The reason for that may have come from our childhood, where that was all that was really available to us in our neighborhoods, or it was easier for our parents to get the fast foods, high-fat foods, than to spend the time cooking fresh vegetables and more healthy foods. So we develop a habit. The second thing that happens with these habits, however, is almost all of them have some addicting component to it, meaning there's a payoff in our bodies for doing that unhealthy behavior. Let's be specific.
Yeah, take me on the specifics of that, doctor, to the eating thing. How, because some people may be saying, wait a minute, how can you say overeating? There's something that could be positive about that in the body.
Well, our bodies are very responsive to the things we need. But some of the things we need, we really like them, and our bodies really like the way we feel whenever we use some of the things that we need a little bit of.
Okay.
Our bodies have a tendency, particularly if we tend to be addicting people who are prone to addiction, we're really going to latch on to that thing that feels good to our body. So let's use the example of sweets. Okay. So sugars occur in a lot of foods. They occur in fruits and vegetables, and our body needs the sugar. So we'll eat that sugar, and we get the fix that our body needs to be healthy. But if we concentrate the sugar, really concentrate it, like in a drink that has sugar in it, or if we concentrate it in a cookie or a pie or a cake, well, our body says, gosh, I really need that. That's what I need. Oh, by the way, I feel really good when I get that.
Okay.
I want to feel good, so I'm going to eat some more of that. And then I'm going to eat some more of it. And then I'm going to eat some more. So what started out to be healthy, when it comes in packaged, concentrated form, actually becomes unhealthy for us. And if we tend toward addiction, we tend to keep using that and eating it and without thinking about it. Our body sort of takes over, and our brain goes on autopilot.
And let the body control.
And the body's out of control.
Let me ask this question before I have to go to break, and then I'm going to come back to some of the other behavior issues. When you talk about the foods then and the addictive behavior, some people may say, well, it's not my fault that I may overeat because it's genetic. It's something that I have, everybody in my family eats a lot. So I must have a genetic predisposition to that. Is that really a reason why we may be overeating? So we have to say, you know, is it in the genes, or is it a part of, like you said, how you've grown up or what you may have been exposed to, which is controlling?
It's overwhelmingly it's overwhelmingly our environment. It is not the genes, except in very, very, very rare circumstances. So there are a few genetic diseases in which the body has lost its capacity to know when the need has been met. In those cases, overeating is out of control. The natural body mechanisms aren't there. In all other cases, it's the way we've learned, the way we've grown up, the way we've interacted with our environment. And that's good news, because we can do something about that.
Okay, well, we're going to take a really quick break and come back and look at some more behaviors. And I want to still pick up on the eating a little bit. I got another couple of questions.
Okay.
Please stay with us. We'll be right back.